body meeting of the spring semester. I hope everyone is doing well so far this week, and we're super excited to have everyone here tonight. So I'm going to first start us off with just a couple updates before I pass this over to Paige, our program coordinator, to introduce Dr. Moore and get us started into tonight's meeting. So our first update is going to be from Ellie, our org SAFMA representative, to give a quick update with the upcoming meeting they have, and then I'm going to pass it along to Akash and Jess, as well as Leah, who are here tonight from the Happiness Campaign, and they're going to give us a brief overview of our club collaboration we have with them for the month of February. So I'm going to kind of let them explain what this is going to look like and how we are going to each take part. So Ellie, you can go ahead and get us started.
All right. Hi, everyone. I'm Ellie. I'm the SAFMA representative for PVMA. We have our upcoming SAFMA meeting next Monday on February 7th at 6 p.m. It's online. Chloe will send out the link in our email. And if you have any questions, feel free to email me about it. It's a great way to get involved, learn a little bit more about the vet school, and you can get a point, and that will be helpful for the upcoming executive board elections. So thank you.
All right, all you, Akash.
Awesome. Thanks, Chloe. And thank you, everybody, for giving us a couple minutes to talk and introduce you to ourselves as well as the Happiness Campaign. Chloe, do you mind if I share my screen real quick? Cool. Awesome. Well, hi, everyone. Thank you so much for taking a few minutes to let us talk. Like Chloe mentioned, my name is Akash Salgia, and I'm a senior here at OSU and part of a new student organization called the Happiness Campaign. And I'm joined here with Jess and Leah, if you both want to quickly introduce yourselves.
Yeah, absolutely. Jess, do you want to go first, or?
Sure. So hi, I'm Jess. I'm a second year here at the Ohio State, and yeah, I'm really excited to be here with you guys.
And then, hi guys, I'm Leah. I'm also a senior like Akash, and yeah, super excited to share with you guys.
Awesome. So to give a quick introduction to kind of who we are and what we're doing. So like I mentioned, we're a relatively new student organization that was formed last spring, and the Happiness Campaign aims to partner with other student organizations at Ohio State to run our monthly campaigns with. And so we're here today because we talked with Chloe and would love to run our February campaign with PVMA. And so the way the program works is that you'll all be able to select one habit out of 5 that are correlated with sustained happiness. And through our website, you can log your habit. And for every day that you successfully complete your habit, we'll donate 10 cents on your behalf to a nonprofit of PVMA's choice. So here are the 5 habits that we've kind of identified that are linked to sustained happiness. And we really encourage you to kind of select a habit that's not already part of your daily routine and also get creative with it. So for instance, healthy eating, you can adapt that to dietary restrictions, and self-reflection can be anything from journaling to talking to a friend. Physical activity can be anything from yoga to lifting weights or running. So we really want this to be really adaptable to everybody and make sure everybody has an awesome time with the campaign. And so our February campaign with PVMA will mark our 3rd campaign. And I kind of want to just quickly share some of the results from our pilot program that we ran last spring. So we had 88 participants in our experimental group, and we had 67 participate in a control group. And so the way these 2 groups differed were the experimental group took an intake survey that we adapted from the University of Oxford, and we kind of call it the happiness questionnaire. And then they participated in our program for 30 days, selected their habit, and logged their daily habits for 30 straight days. And then at the end of the program, they took an outtake survey that were the exact same questions of the happiness questionnaire, And all this data is completely confidential. We just really use it to adapt our program and make sure that it's better for the next month. So when you all sign up, we will ask you to complete the questionnaire. But again, everything's going to be completely confidential. It really just helps us on the back end. The 67 people that participated in the control group didn't actually go through the campaign. All they did is on day one, they filled out the happiness questionnaire, and they weren't really told what this was for. And then on the last day, so the 30th day, they also filled out the happiness questionnaire. And we were really excited that of the 88 participants, there were 653 tasks completed, and we were able to donate $130 to Life Act, which is a Cleveland-based mental health nonprofit. And most exciting for us is that we saw a 7.89% increase in happiness based on the happiness questionnaire. And so when we compare the control group to the participants, so the 67 people versus the 88, we saw over a 7% increase in happiness for the experimental group. And so that's what we're really trying to replicate month after month with different student organizations. And we're really, really excited to be partnering with PVMA for the month of February. And again, Chloe, thank you so much for making this happen. But with that, I will pass it. Oh, wait, one more thing. So to kind of like recap, there were 3 areas of impact that we're targeting. The first is encouraging healthy habits for our participants through, selecting a habit and completing it daily. We did a lot of research behind this and had a lot of mentors help us identify those 5 habits that were correlated with sustained happiness. And we also found a lot of data that suggested that people who have healthy habits do have long-term sustained happiness. The second component is the monetary donation. So for every habit you complete, we will donate to a nonprofit of your choice. And I know that's something Chloe will talk to you all about. And you will all be able to select any nonprofit that you choose, and we'll donate on your behalf. And the third area is awareness on social media. So at the end, we'll share with you our Instagram, and I'll pass that to Leah at the end to talk a little bit about what we're doing on the social media end. But with that, I will pass it to Jess to kind of get everybody kicked off and started with the happiness campaign for February.
Yes, so we're just gonna get you guys like all signed up. So on the next slide should be a QR code that will give you guys like a few seconds to scan. And if you guys want to be involved in the campaign, then just scan that and you should be taken to our happiness campaign website. So I'll give you guys like a few seconds to scan that. But when you scan that, it should kind of look like, it should ask for like a username, an email, and then a password. And once you guys are given like input a password and everything, these are kind of the next 3 pages you should see. So the first one is where you put in that username and password. And then the second one is one of our members, Richard, and he kind of explains the 5 different types of challenges and tasks that you can take upon yourself. And like Akash said, like we encourage you guys to get creative with it. So while it's like physical activity, like really determine like what physical activity means to you guys and like what you would kind of try and like push yourself to do. And then if you scroll down, you should see our intake survey, which is that Oxford survey that Akash also mentioned. And we just like to have you guys take that for our data purposes.
So we'll just kind of give everybody a couple minutes to sign up, select your habit, and kind of fill out this survey. Should only be a couple minutes. It's just a couple quick questions, and then we'll leave you to it.
Hey, Akash, can you go back to the QR code really quick? Awesome, thank you.
So if you all just want to kind of give like a thumbs up if you're ready to move on, or if we need a couple minutes, that's okay too. And if you weren't able to get around to signing up now, I can share this with Chloe, at least the QR code, and then you all can sign up on your own time as well, if that's easier. If you need a little bit more time to select a habit, that's totally understandable.
Yes, that's something I can definitely share.
Awesome, thank you. Cool. So, Jess, if you want to.
Yeah, so this is kind of just like a little bit of a screen recording of what it looks like to log your habit every day. So up top, you have like what your goal is in case you forget or just want a reminder. And once you log into that account, this is what you should see. And every day you just click, I've completed my task and log. And then down at the bottom, you'll see how many times you've completed your task and your personal contribution, as long as your group as a whole and how much you guys have raised together. And if anyone has any questions about like how to log it or anything, feel free to ask. And then this is just our social media, like Akash mentioned before. I'm pass it off to Leah to talk a little bit more about what's going on with social media for this campaign.
Yeah, absolutely. So this is pretty self-explanatory. We have our Instagram. I will drop it in the chat right now. So it'll just be at the happiness campaign with some underscores. We should pop up with the same logo. So if you guys want to give us a follow right now, we'll be kind of posting along your progress. And then at the end, we should kind of have like a final program recap of you guys, either put on a post or a story. So that just kind of keeps you updated. But throughout the month, we're going to be posting, maybe just tips that'll work with someone's habit or just some happiness things. And you're welcome to keep following it even after your February program is ended. We just kind of think it's a little bright spot in someone's Instagram feed. So that's just kind of what the Instagram is going to look like. And we should have a link as well. We haven't touched it super recently, but we also have a Spotify playlist where all the e-board, we kind of just added some of our favorite songs that make us happy. And we've had people say that it's just been a fun, like, walk to class listen. So you're welcome to follow that as well. But yeah, those are our socials. So give us a follow. And then you'll find a link tree in our bio that can kind of lead you to more things.
Awesome. That's everything we had planned. But thank you guys so much for giving us a couple minutes to talk. And hope you're all just as excited as we are for the February campaign. This is our third campaign, like we mentioned, and I think it's just been so great to see, two different groups go through this and have quantitative results that kind of show that through, selecting and keeping with a habit, you're able to increase your happiness. So yeah, we'll leave it at that. But if you have any questions, we will share our email address, and you can also just message us through Instagram or anything like that. But yeah, hope you guys enjoy the month of February, and we'll be in touch throughout the month, whether that's through GroupMe or I think February 16th and then March 2nd, we'll also be joining your meetings to kind of just have a conversation and give a couple updates.
Perfect. Thank you guys so much for taking a few minutes out of your day to talk to us. We're really excited to collaborate with you all for the month of February and just to up everyone's happiness and give back in the process. So thank you guys for joining us for a minute. And then Paige, whenever you're ready, you can go ahead and start us off. Bye, guys.
Bye, thank you.
All right, so I'm really excited to introduce our speaker for tonight. She is a tenured professor of neurology and neurosurgery at Ohio State's College of Veterinary Medicine. So to keep the introduction short, Dr. Moore, I'm going to go ahead and hand it over to you.
Sounds good. Thank you. And thank you guys so much for the invitation tonight. Let me see if I can get my screen shared here. All right. Okay, can you guys see that?
Yes, we can.
Perfect. And there we go. Okay, well, so again, thank you guys for the invitation tonight. And I'm very happy to come and talk to you guys a little bit about veterinary neurology. I was actually surprised to hear that folks were so interested in hearing about that. It's a little bit of a niche topic in vet med. So I'm very excited to be able to share that with some future veterinarians and maybe spark some interest in the specialty moving forward. So I thought what I would do tonight actually is just share a little bit about my background and how I got to the decision to become a veterinary neurologist, because it was a little bit of a circuitous path. So I thought I might share a little bit about that, as well as talk just a bit about what a veterinary neurologist does on a daily basis, and then share a case example and talk a little bit about how we might work through the diagnosis and treatment of that particular patient. And then definitely at the end, plan to leave some time for questions and answers that you guys may have. So how did I get to be a veterinary neurologist? Well, like I said, it was a little bit of a roundabout path, to be perfectly honest. So I was definitely not one of those students who knew from a young age that I wanted to be a veterinarian. In fact, I actually didn't even consider that as a career option till I was between my second and third year of undergrad. So a little bit weird by veterinarian standards, because I think most of us know from about the age of 5, right? It seems that that's kind of the average age that most people decide they want to be a veterinarian. That was not me for whatever reason. It wasn't because I didn't like vet med. It just actually had not crossed my path. My parents were not big pet owners. Pets were just really not a big part of our lives. And so it just wasn't something that I had initially had on my radar. So I went to undergrad at Georgetown College, which is a small liberal arts school in Kentucky, not to be confused with Georgetown University. So Georgetown College is a super tiny school. Actually, it was a smaller undergraduate school than my high school was. So very small school. I was a chemistry major at Georgetown, and because it was such a small school, there was not a pre-vet program there. There was not an animal science program there. In fact, I'm going to venture to guess I may be one of the very few, if not the only Georgetown graduates that's gone on to vet school. So just not a focus of that institution as an undergraduate program. And so like I said, I was a chemistry major. And so my initial career plan was to go to grad school for chemistry. So I wanted to be a forensic chemist. And I thought that would be a really interesting and exciting career. And I still think it probably would be. I'm very glad that's not the route I went, but I still think it's an interesting potentially an interesting career. But what actually happened, and it's a great, I think, example of how lots of things happen for a reason in your life. I had applied actually for a summer internship program at the Kentucky State Diagnostic Lab in their forensic chemistry lab. And I got accepted to that program between my second and third year of undergrad, and I was really excited about it, and could not wait to do that program in the summer. And right before I was meant to start, the state of Kentucky changed some of their guidelines when it came to security clearance for the laboratory there. And all of a sudden, they weren't allowed to take undergraduate interns anymore. And so I got a phone call that said, "Hey, we're really sorry. We can't have you in the lab for the summer after all." And I was so upset. And it wasn't even somebody from the lab that called me. It was a sort of random HR person for the state of Kentucky that made that phone call. And while I was on the call, they said, we can't offer you the internship. What we do have, if you're interested, is a summer job working at the Kentucky Horse Park in the barns there with the horses. And I was mad. So to me, that at the time was not even remotely equivalent to the job that I was meant to have for the summer. I had no interest in horses. I didn't want to be outside all summer where it was going to be really hot and dirty and sweaty. And I was not very happy with that offer. But the reality was that I didn't have a summer job. And so I decided that I would give it a try because it was really late and I didn't have a lot of opportunity to look for something else. And so I took that job and I loved it. Probably one of my absolute favorite things I have ever done in terms of jobs besides the one I have now. Great people, great atmosphere, lots of fun. I loved the horses. And honestly, it really opened up my eyes to the possibility of veterinary medicine as a career. So if I had not had that happen, I think I probably would be in a very different place in my life. And so I actually feel very fortunate to have had that turn of events. And so after working at that job for the summer, I went into my third year of undergrad, and sort of another lucky sequence of events, our botany teacher actually had asked us to fill out some little index cards at the beginning of the year asking sort of what our interests were. And so I had written, potentially interested in veterinary medicine after that summer opportunity that I had. And her veterinarian, who was local in Georgetown, had actually mentioned to her that they were looking for a veterinary assistant type role. So someone to come in and sort of work, part-time for them, doing kennel help and things like that. And so she actually referred me for that job. So I got some small animal experience out of that. And ultimately, as a result, the folks that worked at that practice were the veterinarians that wrote me my letters of recommendation for vet school. And I was very lucky to get into Auburn University when I applied. So I started vet school at Auburn University, thought I had maybe a large animal interest, but kind of based on my limited equine experience prior to that, and maybe some public health experience as well. But as things progressed and I got to spend time in clinics during my fourth year, I found that I really loved clinical neurology. And so decided to go on and do an internship and then a residency in neurology. So I did my internship at the University of Missouri, did my residency at North Carolina State University in neurology and neurosurgery. And then I came to Ohio State in 2009 as a faculty member, and I have been here ever since. So my job right now involves a little bit of clinical research, some teaching, a lot of practice of veterinary medicine in our small animal hospital here. And then I am also the director of our veterinary clinical trials office at the Veterinary Medical Center, which has been a great opportunity to help to promote some veterinary research really kind of at a new level. So kind of like I said, a circuitous path to where I am now. But I think, as I said, most things happen for a reason. And I was really lucky to have some of the things come along my way that did. So one question I think a lot of people have who aren't familiar with our specialty is, what does a veterinary neurologist do on a daily basis? So we are a specialty that focuses on the diagnosis and treatment of all problems related to the brain, the spinal cord, and the peripheral nervous system. So nerves, muscles, neuromuscular junction. And most veterinary neurologists are actually trained in both medical and surgical neurology. So a little bit different than on the human side. So in human medicine, typically there are medical neurologists and then there are neurosurgeons, and they're two very different training pathways. And vet med, they're combined. So that's actually something that I think is really a draw for a lot of people to our specialty, is that you get to do a little bit of everything. So you get to do the medical cases, you get to do the surgical cases, a lot of fun to get to do both. And it certainly means that on a daily basis, you're never bored. So you're always seeing lots of different kinds of cases. So we manage a number of different diseases, primarily in dogs and cats. We do see some large animals as well, although probably 90% of our caseload is going to be dogs and cats, at least here at OSU. So types of cases that we might see in our veterinary neurology practice, we'll see patients that have balance problems, so vestibular disease. And I've got some videos here. I'm going to apologize. I know that videos do not play well on Zoom, and so they're probably going to look a little bit jumpy. And unfortunately, that is just one of the major downsides to Zoom in terms of technology, but hopefully you guys can get a sense. This is actually a 17-year-old dog that came in with a really sudden onset of vertigo. And hopefully you can appreciate here that she's got kind of a tilt of her head to one side. She looks like she's kind of got her legs all splayed out. You can see she's got some what we call nystagmus, that really jerky movement to the eyes here. All really typical signs that we might see in a patient with a balance problem. This dog actually ultimately had a diagnosis of idiopathic vestibular disease, which is a benign type of vertigo, kind of similar to what people with benign vertigo might have. We see patients with other brain-related issues. This is an alpaca, young alpaca with a problem of the cerebellum. And you'll have to watch a little bit carefully to catch what's going on with him. Hopefully you guys can see he's got this really fine tremor of the head and of the ears. And it's in alpacas with the long neck, it's actually really pronounced. You can kind of see the neck moving, really kind of classic type of clinical signs that we'll see in a patient with cerebellar disease. And certainly we see spinal cord problems as well. So we've got here Andy, who's a 7-year-old dachshund that has ruptured a disc in his back. So dachshunds and a lot of our kind of short leg, long back breeds have a lot of disc disease. And if you watch him walk, you can see he's pretty wobbly in the back end there. His legs are kind of going all over the place as he goes to walk around. Then he kind of falls over there. And then actually here we've got over on the other side of the screen, we've got a cat with a spinal fracture. So you can see that we've got some reduced mobility in the back legs there. She's able to move them, but not able to walk around on her own. And so these are two examples of cases that we would have a way to address surgically. So spinal fractures, we can go in and stabilize those surgically. Disc problems, we can go in and do a discectomy, similar to what you might think about in a person with a disc problem. So both medical and surgical things that we would address in the clinic. So how would one become a veterinary neurologist? So if you're interested in that, that would involve being a graduate from veterinary school. So all of the veterinary specialists will have gone through the 4-year DVM program. After that, most people will do a 1-year, what's called a rotating internship. So that's an internship where you spend several weeks at a time kind of rotating through all kinds of different medical and surgical specialties. So you might spend 2 or 3 weeks on internal medicine and 2 or 3 on neurology, and then cardiology and emergency and critical care, really with the goal of getting some more clinical training, and also with the goal of kind of solidifying what you like to do. So if you want to go on to do a residency, you want to be really sure that you're passionate about it and it's what you want to spend your life focusing on, because it really is narrowing things down quite a lot to one particular type of diseases. So you want to make sure that you really enjoy that before you go through residency. So rotating internship for 1 year. And then from there, people will go on to do a residency program, which typically isn't a 3-year program. And for neurology, people will train in both medical and surgical neurology. And then as part of the neurology training, there are 2 boards exams that you have to take. So there is a general medicine exam that all of the internal medicine and neurology and cardiology residents take, and that happens at the end of your 2nd year of your residency. And then if you pass that successfully, you go on to take a more neurology specific exam at the end of your 3rd year. And if you pass that, then you become a board certified veterinary neurologist. As I said, surgical training is part of your residency as well. And then there is an extra neurosurgical certificate you can go on to get, which is just a little bit more training in neurosurgery as well. And so really for people who want to do neurology, you need to very much like both medical and surgical cases, because for us, it's probably about 50-50 of one versus the other. So, and maybe a little bit of behavior as well. If you like animal behavior, this could also be a specialty for you. And you'll see why I say that in a minute when we go on to look at our case, because that's a bit of a component of the case we're going to talk about as well. So let's move on and just talk about an example of the type of case that, that we may see on our veterinary neurology service. So this is Louie. And Louie came into us with a 2-year history of some episodes, and I'm going to show you a video of what those looked like. So Louie's 2, these started around 4 months of age or so. So these have been happening pretty much his entire life. And initially when the owners noticed them, they were pretty mild. They would just happen on occasion and they were infrequent. But what they have noticed is that they had increased in frequency over the last few months, really now to the point where they were lasting for hours per day. And sometimes only stopping when he went to sleep, actually. So really severe progression of the frequency of these. And of course, that's what led them to bring him in to see us. So this is Louie. And this is what he was doing when we met him. So hopefully you guys can see he's almost kind of looking up at something, right? And then kind of snapping at the air. He'll do it even when he's in the cage here as well. And I promise you, he's not biting at a fly or anything like that. So there's nothing there, even though it kind of almost looks sometimes like he's seeing something there, right? You can almost see his eyes sort of focus on something and then do this. So I don't know if has anybody worked in a small animal practice and seen a dog that's done this before? It's not a terribly uncommon presentation as far as neurologic concerns go. So we see a fair number of dogs that will do this. And this dog, of course, as we said, was doing this a lot, so almost all day long at the point that that his owner brought him in. So to the point where he really couldn't do much else. The quality of life was really impacted by this. So what are these episodes? So we term these fly biting episodes for obvious reasons, right? So if you look at the behavior, if anybody's ever seen a dog or other animal trying to bite at a fly in the air, that's exactly what it looks like this dog is doing. But again, I promise there's no fly that's there when he's doing this. So this fly biting behavior is something that we do see with some frequency in veterinary medicine. And so, the question is, what is this behavior? And so there's a lot of different theories about what this may be. So actually for a very long time, we thought that this might be focal seizure activities or partial seizures, kind of petit mal type seizures. And there's maybe some evidence to suggest that in some patients that could be the case. There are some animals that will do this as a manifestation of obsessive obsessive compulsive behavior. So some dogs, we can see all kinds of different behavior problems in dogs, and we do see some OCD type presentations in dogs, and sometimes they'll do this type of behavior as part of this. There are some case reports of dogs that have ocular disease that will do this. So does anybody have a vitriol floater? Ever see those little floaters go past your eye when your eye is closed? So there are actually some reports of dogs with vitriol floaters, little bits of vitreous humor in the back of the eye that float past your retina, and they're actually seeing something. It's just not something we can see. So there are some reports of dogs that do this with vitriol floaters. And then really interestingly, and what I'll talk a little bit more about, is that sometimes we can see this behavior as a manifestation of a more systemic disease. And in particular, we can sometimes see it in conjunction with gastrointestinal problems. So stomach, intestines, issues in those areas, which sounds a little bit weird at first, right? But we'll talk a little bit more about why we might see that. So how do we categorize these a little bit further? So we said that there, is maybe some evidence that these could be partial seizures. There's maybe some evidence that these could be behavioral OCD type things in some patients. So this is a study of a group of dogs that were doing this fly biting behavior, and they actually did a lot of different testing on these guys. They did MRIs to make sure that their brain looked normal. They looked at spinal fluid to make sure they didn't have meningitis. They actually did an EEG, so an electroencephalogram, to look at brain waves and really try to document whether this could be seizure activity. And in some of these guys, it was. So there were some of these dogs that very clearly had evidence of this being a seizure on their EEG. And those dogs seem to respond really well to seizure medications in those instances. But there were some dogs where all of these tests checked out normal, and they placed them on a medication that we will often use for obsessive compulsive behavior called fluoxetine. And actually, more dogs in this study got better on fluoxetine than got better on seizure meds, which is kind of interesting. So it makes you think that there probably is a strong behavioral component to this problem, at least in a subset of these dogs. And then this is another study that looked at some other underlying health problems that these dogs with these fly biting type behaviors might have. And one really interesting thing that came out of this study is that a lot of these dogs actually had underlying GI disease, so inflammatory bowel disease, in fact, probably being the most common diagnosis that was made in a group of these dogs. And even more interesting, once they were diagnosed with inflammatory bowel disease and treated, often with a combination of steroids and even more so with diet change, so hypoallergenic diets, a lot of these dogs had improvement, and in some of them, even complete resolution of the fly biting behavior. So a suggestion that there's a really strong link between gastrointestinal problems and this behavior, which again is really kind of weird and in some ways hard to explain. But one thing that we are learning more and more is that there is a really important connection between the gut and the brain. So you may have heard of the phrase the gut-brain axis before. It's something we talk about a lot, but it's really the concept that what's going on in your gastrointestinal tract, and maybe even more importantly, the types of bacteria that live in there, can actually influence the types of neurotransmitters that your brain produces, can influence the type of inflammatory cells that are floating around in your bloodstream. And having good gastrointestinal health can actually improve health in other areas of the body. So this might be an example of where that gastrointestinal health can influence the nervous system. So that's a kind of an interesting survey of the different types of problems we might think about causing this fly biting behavior. And you can probably get an idea that that's a pretty broad list of potential things, right? So we said seizures, we said obsessive compulsive disorder. We said gastrointestinal problems. And so how do we think about managing these dogs in the clinic? So I think, you know, the first thing that we always talk to owners about with these dogs when they come in to see us is that they are probably a group of dogs that have a multitude of different problems. So this is not so much a diagnosis as it is a syndrome. So meaning it's a type of clinical sign that can be caused by a lot of different problems, right? So we have to get to the bottom of which one is the issue in the particular dog that we're seeing. And so some things that can help us in that regard actually just come from taking a good history from the owner. So talking to the owner a bit more about the types of behavior that they see in their dog at home. Are there any other red flags for behavior problems in them? So do they do other types of compulsive behavior at home? Do they have things like separation anxiety or any other red flags that they may have more stress than the average pet at home? And so if we start to hear those things, a lot of times we'll choose to treat first with things like fluoxetine and some of these other behavioral modifying drugs, thinking more along the obsessive compulsive disorder thought process. We also ask a lot about any other red flags related to gastrointestinal disease. You know, do these dogs seem to have a sensitive stomach? Do they have chronic diarrhea? Are there other things that, you know, do the signs tend to flare up more after they eat? Anything that might be a red flag for, you know, their intestinal tract being a contributor to this problem. And so if we get red flags on the history in that area, we might think more about both looking a little further into what type of GI disease the dog might have, you know, as well as treating for that with something like a hypoallergenic diet, a food elimination trial, to try to see if that that may make a difference for the dog. Certainly, in some patients, we ultimately do end up starting them on a seizure medication because these other things don't seem to pan out in terms of underlying diagnoses. And so we said, again, some of these dogs are having, you know, focal seizures. And so seizure medications can help for some patients. So the other thing we will usually talk about with owners is that when we're treating these guys, we need to recognize that we may start with one angle, and if that doesn't work, we may change to another. So it may be that we cycle through some of these different approaches to see if we can find what works best for that individual pet. And the other thing that we always have to remember, and this is really common in pets with behavioral problems, is that sometimes behaviors start for one reason and then they continue for another. So an example of that might be a dog that has gastrointestinal disease who becomes very anxious because they're chronically uncomfortable related to their GI disease. So then they can develop these kind of secondary anxiety type behaviors. And it may be that you treat their GI disease and clear that up, but they still have this kind of cycle of anxiety and stress that we need to treat in other ways. So sometimes it's a little more complex. And some of these things can be very interrelated to each other. So that's kind of just a quick sort of whirlwind tour through veterinary neurology as a whole and through, you know, one of the cases that we sometimes see. Of course, we see lots of other things too. So lots of dogs with disc problems. We see lots of dogs with epilepsy. We looked at an example of a dog with some balance problems. That's a pretty typical thing that we'll see come in to our service as well. But just an example of a case that you know, we might see in the clinic, and we might kind of work through how we think about treatment for that patient. I will tell you that the dog Louie that we looked at the video of at the start of that discussion, we actually treated that dog with seizure medications, and he had a really good response to that. So we started him on Phenobarbital, which is one of the more common seizure drugs that we'll use in dogs. And he went from having those episodes really almost continuously all day long to only having one every couple of weeks. So big response to seizure medications in that particular dog. So I'll kind of stop there because I know we wanted to leave time for people to ask questions. And so I'm definitely happy to talk about anything vet med related, whether it's specific to neurology or just about sort of vet school in general, or any questions that people might have.
I have a question. So when you have a patient presenting for some sort of neurological symptom, do you normally try to find the cause first, like changing the food to help with the GI issue that might be causing it, or do you normally tend to lean towards medication?
Yeah, it a little bit depends on the situation and how serious the problem is. So, in a patient that has mild signs that are infrequent, we often have a little more time to sort of do things like adjust diet and, things like that in a case where that might make sense. In a dog where, those types of episodes are happening as frequently as they were with Louis, we were pretty quick to try to start some medications in him because it was really interfering with his quality of life at that point.
I also have a question, Dr. Moore. I was wondering if you prefer more the clinical side or surgical side of veterinary neurology, and looking at the more surgical side, do you have like a specific surgery that like has been a favorite of yours or something that you really do enjoy?
Yeah, so I really like both. So, and again, I think that's kind of a typical answer that you'll get from a neurologist is that we really like both. And that's probably one of the big things that pulls us into this specialty as opposed to a just surgery or just more of a medical specialty. I would have probably 10 years ago, I would have told you that I much preferred surgery. And maybe part of that is because typically those types of problems are things that we can fix definitively. So you can go in and you do a procedure and you make it better, and that's the end of it. And that can be really rewarding. But I think as I've gotten a little older, I'm realizing that the medical things sometimes are more interesting because they're more of a puzzle and they do require you to think a lot more. And they also allow you to develop more of a relationship with your clients because they tend to be the things that don't get better and go away entirely. So if you think about a patient with epilepsy, even if they're on a medication that's really helpful to them, they're probably always going to come back to see you for follow-up. And so you build more relationships with people, I think, with the medical problems. And so I'm learning to enjoy those more as I get older. But I really do like them both. From a surgical procedure standpoint, there are a lot of things that are really fun. So I really like doing surgery on dogs with disc problems, actually. Again, probably because they are things we can fix. So I know we can go in and we can make this better. And 99% of the time, this is going to work. And so it can be a very rewarding thing to do. But I also enjoy brain surgery a lot as well. Maybe because we don't get to do it quite as much as some of the other spinal things. And so it's just a little more, it's exciting to do something different. And then, of course, anything that we get to do that's on a species that's unusual for us. So, if someone from the zoo has a case that needs back surgery, even if it's a procedure we do all the time, if it's in a tiger, all of a sudden that's really exciting, right? So it's fun to just see some species from time to time that aren't typical for us. I saw there's a question in the chat about how common neurologic issues are. So they're very common. So there are certain problems related to the nervous system that are extremely common. And even if you are in general practice, you will see them routinely. So examples of those probably are going to be patients with epilepsy. So we see a lot of dogs with epilepsy that end up needing lifelong care related to that. And so that's a pretty typical problem that even folks in general practice will spend a lot of time managing. Some of the vertigo type problems actually are pretty common. And we'll see those a lot in general practice as well. And then spinal problems in terms of chronic disc problems, also very common. So most patients with disc problems don't go on to need surgery. And so they tend to be more sort of chronic, management in terms of pain management and rehabilitation, physical therapy type approaches. And so those are also very, very common, particularly in older dogs and cats. And so super common problem that everybody who does any small animal work will no doubt see. Let's see, there's a question about benefits of specializing in a particular field as opposed to general practice. I think it's all about what you like, to be honest. So there are people who really love the sort of breadth of opportunities and different types of cases that you see in general practice. There are people who really love one specialty in particular. And so if you happen to fall in that category of being really, really interested in a particular specialty, that would probably be a selling point for specializing. And it's just sort of two different approaches to how you like to see cases and manage them. So definitely not a right or wrong in that regard, but just a little bit more about what you kind of like on a daily basis. Let's see, how much can Phenobarb help with severe seizure cases? Can help a lot. So Phenobarbital is one of the seizure medications that we use probably the most, both in dogs and cats. And we use it a lot for two reasons. One is it's pretty cost effective, and anybody who's worked in a veterinary clinic knows that that financial piece is a big part of treatment decision making for our owners, because most of them don't have pet insurance. And so we're always thinking about, well, from a cost perspective, what makes the most sense for people. So Phenobarbital is pretty inexpensive, and it works really well. So about 75% of our epileptics will have a good response to phenobarbital. So it's probably the drug that we see work the best out of any options that we have. There are lots of other ones that work well too, but that's a really common one, and we can see it can help quite a lot in many of our patients. Let's see, then we have a question that says, what happens when you have symptoms that could be from many different things? What steps would you take to narrow it down? So it's going to depend. So one of the things in neurology that's really important for us is doing a neurologic exam. So some of you guys probably have not seen what a neurologic exam looks like in a dog or a cat before, but in many ways it's really similar to the types of things that a human neurologist might do if you were to visit them, right? So testing reflexes, looking at the nerves of the face, checking the pupils, watching dogs and cats walk to see if they have any wobbliness to their gait or trouble with foot placement. And that can be very helpful in starting to narrow down where the problem is. And once we have an idea of what part of the nervous system is involved, we can start to make a list of the types of problems that make sense in that area. So there are particular problems that seem to target one area of the spinal cord more than another. So we can sort of make a list of what those might be if we're dealing with a spinal cord problem. And then we also look at how quickly the problem comes on and how quickly it gets worse, because that progression, the onset and progression of disease actually can give you a good idea of what things make sense in terms of potential diagnoses versus what doesn't, because we see very different patterns with, for example, something like a tumor as compared to something like a ruptured disc or a stroke and things like that. So just seeing the onset and progression can be really helpful. The reality is that in neurology, some of the problems that we are talking about, in order to get a final diagnosis for those, we have to do some type of imaging of the area in question. And so sometimes that can be x-rays. So if we are suspicious that the problem is related to, say, the bones of the spine, x-rays can be really helpful with that. Frustratingly, in veterinary medicine, a lot of times, because we're more interested in the spinal cord and the brain, things like a CT scan or an MRI end up being more useful if we really want to get a final answer on what's going on, just because the brain and spinal cord, of course, are encased in bone, and so you can't see those on an X-ray. And so we often have to do some additional testing to look at those a bit more. And we do that quite a lot. So sometimes people are surprised to hear that dogs and cats get MRIs. We do a lot of MRIs in dogs and cats, actually, in our practice. The reality is, though, that is probably a small percentage of the pet population. that has an owner that's motivated to do that level of care for them. But it certainly is possible. And usually the motivation is not related to how much they care for the pet, but more the financial component of things. So there are a lot of people who I know would do lots of things for their pet if there was, health insurance involved that would cover it. But we are able to do those things. And there definitely are, a lot of owners that are interested. So that's kind of how we sort of would work through the problem solving process. So the first thing is deciding where the problem is based on the patient's neurologic exam, and then coming up with a list of potential diseases that make sense for that area and for how things have progressed. And then from there, thinking about, is there a type of imaging that we can use to rule in and rule out things? Sometimes blood work can be helpful. So sometimes we can see patients with neurologic problems secondary to liver failure, for example. So there's a condition called hepatic encephalopathy, where toxins from your bloodstream build up when the liver can't detoxify those and clean them out. And so sometimes blood work in and of itself can be diagnostic. In neurology, that's probably a small percentage of the time. And most of the time we are thinking about doing some additional imaging to try to get to the bottom of it. Sometimes we can also look at that list of problems that we think are possibilities and decide what we think is the highest on the list and just treat accordingly. So, for example, if we thought a patient had meningitis, most likely, and the owner was not able to afford a spinal tap, we might just go ahead and treat that because the consequences of not treating it are really high. And there's a likelihood we could make that better with, either antibiotics or sometimes steroids, depending on the cause. So sometimes we are picking what we think is most likely and kind of, treating accordingly. Let's see, there's a question about insurance not being prevalent in vet med. Do you think the cost deters owners from seeking help from a neurologist? And how do you try to help lower the cost when possible? Yeah, I think it can, to be honest. I think, there are definitely the owners that we see through our neurology service are a subset of the population. And there is a financial component to that as well. So I think it can be a deterrent to care. In our hospital, we try to be very conscious of cost of things like exam fees and not having those be so high that they're kind of a gatekeeper to getting into the hospital. So our hope would be that sometimes even if an owner can't afford something like an MRI, hopefully they can afford to come in for an exam, and we can at least sort of talk through what possibilities may be and what treatments we might be able to offer, even just sort of empirically, if we were to take our best guess at what's going on. Let's see, have we noticed any increase in Lyme disease cases being presented? So we don't see a lot of neurologic manifestations of Lyme disease, at least not that we recognize. Definitely in Ohio, there is an increase in the number of Lyme positive dogs. So that's a trend that we've seen over the last probably decade or so compared to what we might have said 20 years ago. And there are some more systemic health problems that go along with that. At least at this point, we haven't really seen anything suggesting that there's a definitive increase in like neurologic manifestations of Lyme. It's something that we do test for, though, in patients that have signs that might be suggestive of that. That certainly is a fairly easy test actually to do. So that is something that we'll do commonly. Any other questions?
I think there was one question up top I saw that I don't know if you touched on. Yeah, no worries. It says, do you have any test taking strategies that worked best for you while in residency or during vet school?
Oh, good question. Test taking strategies. So I can tell you what worked for me, which I fully acknowledge probably doesn't work for everybody. But I am a very visual learner. And so as annoying as this is going to sound, what really worked for me to study was just copying over notes and information from what I was reading. And I would typically do it in different colors. So I would color code things based on sort of topic area or, whatever sort of made sense based on the material in terms of subdividing it up. I had these colored pens and I would do things really by color and just sort of repeating them. And I would really get to a point where when I went to take an exam, I could see the paper and I could think, oh, well, that was in purple and it was on the left-hand side. And it said this. And so for me, that just really worked because I'm a really visual person. Not everybody is that way. So different people learn in different ways. I also did a lot of group studying. So I had a really core group of about 3 friends that weren't even really my best friends, but they were the friends that I knew that I could study with and stay focused and not really get off track. So we just happened to be a group that all learned similarly. And so we would get together before exams and study. I'm a big flashcard person too. Actually, for my neurology boards, I had a stack of flashcards that probably was a 2-story building by the time it was all said and done, with all of the little sort of snippets of facts and questions that, I thought might be on the exam, or I had heard at some point someone might ask me, and I just went through them over and over and over. So repetition and kind of visual learning are the 2 things that really worked for me. Let's see, I think I just saw a new one pop up too. So what's a step or resource you would recommend for undergrads interested in learning more about veterinary neurology? So a couple of things that you could think about doing. So one is you could try to shadow with a veterinary neurologist. I think that would be a great opportunity. So we definitely have folks come shadow from time to time in the clinic with us. I know MedVet, which is one of the private specialty practices in town, sometimes can have students shadow as well. So that would be a great way actually to get a little more experience and just kind of see what things look like on a daily basis. And then certainly once you start vet school, there are all kinds of opportunities for that as well. So just getting your feet wet in the clinics and kind of seeing how you like it. So, and I would encourage you, if you think you're interested in neurology, make sure that you explore other areas too, because hopefully you kind of got the sense as I went through my career progression that there were several times where I really, really thought I wanted to do one thing, and it turns out that wasn't going to be the right choice for me. And so keep your mind open, even if you think neurology is it for you. Check out cardiology and dermatology and general practice, and keep doors open, because you'll have an experience one day and you'll just know this is what I want to do. So don't close doors for yourself. Always keep things open whenever you can. Let's see, question about how did your board's exam compare difficulty wise to the NAVLE? So yeah, it's an interesting question. So in some ways, I think it was, I don't want to say easier than the NAVLE. In some ways it was harder. I think that the depth of material that we were required to know for the neurology boards was much more. But what was easier about it is it was in one specific area. And so you knew kind of, it was sort of a finite, amount of information that you knew you needed to study, whereas the NAVLE is a lot more broad, right? So it's everything from chickens to dogs to cats to horses and everything in between. And so particularly when you have decided that your focus area is in one species, all of a sudden it's harder to learn about chickens if chickens aren't your thing, right? So I think that the NAVLE prep was harder than the neuro prep, because for me, the neuro prep was everything I was, interested in and learning, and anything I learned there I knew was going to be important for me for life. So I think they were just really different exams. I don't know that one was easier than the other. I think they both required similar test taking strategies. So, being a savvy test taker goes a long way everywhere from undergrad to NAVLE to boards exams later on.
Perfect. Well, thank you so much, Dr. Moore. I know it's a little bit past 8, so thank you for staying and speaking.
Oh, no worries.
But
Thank you guys.
Of course. Thank you for coming. I'll stick around a little bit for questions if anyone has anything. But again, just thank you so much for coming. We are really glad to listen and learn from you tonight.
Well, I'm happy to be here. And if at any point anybody decides they do want to come shadow over in neuro, feel free to reach out, because we could absolutely have you come hang out and kind of see what it's like to be in neurology on a daily basis. And everybody stay safe and warm. Hopefully this weather doesn't turn out to be all that it's cracked up to be here.
Yes, you as well.
Thanks. You guys have a good night.
All right, you too.
Thank you.
Bye-bye.
Paige, you are killing it on the speakers.
Oh, thank you. I'm trying. She was great. She's such a sweetheart.
I would have to agree.
Yeah, it was a nice touch with the videos. She had like a video for everything. That was awesome.
I know, technology savvy as well. We love it.
I know, we really do. Is there anything else that you needed from me? Do you need the
Maybe
attendance sheet?
list. Yeah.
Okay.
Yeah, and if you could send that to me or even just write on over to Fiona if you want. But that's
Okay.
it, I think. Yeah,
All right, sounds good. I'll send that to you guys.
perfect. Thank you so much.
Yeah, thank you for leading the meeting and introducing everyone.
Yes, no worries. Thank you.
See ya.
Bye, guys.